We would like to present the relationship between urodynamic study findings and post-micturition dribble in male patients. We have no CUI with regard to our presentation. The term post-micturition dribble is used when an individual experiences leakage of urine immediately after finishing urination. PMD is commonly observed as like the other lower urinary tract symptoms, and it significantly exacerbates quality of life. The aim of this retrospective study is to elucidate the pathophysiology of PMD through analyzing urodynamic study findings and symptoms questionnaire. We retrospectively evaluated the relationship between the urodynamic study findings and the modified International Prostate Symptom Score in male patients. The MIPSS consists of 8 subscores related to LUTS: incomplete emptying, frequency, intermittency, urgency, weak stream, straining, nocturia, and PMD, and one question related to quality of life. This slide shows modified IPSS. As shown in this slide, post-micturition dribble is incorporated into IPSS. We conducted multivariate regression analysis to investigate which variables affect PMD. The variables are prostate volume, post-void residual, urodynamic study findings, bladder outlet obstruction index, bladder contractility index, bladder voiding efficiency. Patients' characteristics show that the patients with large prostate volume and high level of BOO index are included in the analysis. We divided the patients into two groups, with and without PMD. Statistical significant differences are observed in prostate volume and BOO index. Univariate and multivariate analysis showed that prostate volume and BOO index are statistically significant predictor of PMD. These figures show that large prostate volume and severe bladder outlet obstruction are significantly associated with PMD. Univariate and multivariate analyses were conducted to investigate which IPSS subscores were associated with QOL. Post-micturition dribble is significantly associated with worse QOL. Discussion. These results showed that prostate volume and BOO index were significantly associated with PMD. Ishii reported that BOO induced vortex in bladder outlet, which resulted in hydraulic energy loss. Minami reported that BOO index significantly correlated with wide posterior prostatic urethra. Thus, patients with BOO might have large volume of urine in the prostatic urethra after finishing urination, resulting in PMD. A previous community-based survey reported that prostate volume did not correlate with PMD. However, this previous survey included the patients with relatively small prostate volume compared with our hospital-based study. The patients with large prostate volume who seek treatment for post-micturition dribble might have a relationship between prostate volume, BOO index, and PMD. PMD exacerbates QOL, and which might be relieved by improving BOO. This aspect should be evaluated in future prospective study. In conclusion, we demonstrated that prostate volume and BOO index had significant association with PMD and which exacerbated QOL. Pharmaceutical or surgical approach, such as relieving BOO, might be effective in improving PMD.